was laying in bed and I felt like something's not right. And I got up out of bed. My dad was there. We went to a Texas med clinic, and it got to the point where I couldn't talk anymore. And then I just kind of fell over. They caught me and put me on a stretcher. They were putting me into the ambulance. And I laid down, and that was the last thing I remember. I remember looking at the wall and seeing the date and going, that date's wrong. Like, that is not the right date. It's the 25th of January in the new year. I missed Christmas. That was kind of my roller coaster, was just being in and out of consciousness. And it was double pneumonia and MRSA. And I thought I was never gonna make it home. And I just remember thinking, is this my life? Am I just gonna be in these four walls my whole life? Dr. Mello, he's always been right there with me and been there for me.
How do I describe Mary? Very simple, resilient. It's somebody that wanted to get better.
The Chest Foundation is a nonprofit organization that's part of the American College of Chest Physicians, which we like to call CHEST.
I think 22 years ago, two former presidents of CHEST, Dr. Bart Chernow and Dr. Ed Rosenau, felt like we needed a philanthropic wing of our organization.
Our focus is really three main key areas. So we have patient education, clinical research, and community service. And so we really like to involve our clinicians to partner with us on how to make better patient education and ultimately better outcomes for patients.
We have critical care units that basically reproduce a real-life setting where people can be trained, and by doing and learning in that setting, our opportunities in education, I really think, are unique at CHEST because of what our simulation center allows us to take advantage of in Glenview.
We also put on our own programs like the Lung Health Experience, and really that is a program born of coalition. We partner with so many different advocacy groups to really talk about what does lung health mean to the community at large. And when they're able to go through that, right, they're able to have a lung function test, they're able to gain more information about many different diseases with all of our coalitions built into it. And then we have a few fun gaming opportunities where they can see real lungs and how they expand and contract. We're really trying to create experience for many of the cities we've gone to, whether that be Los Angeles or Chicago or San Antonio.
Helping a foundation like the Chest Foundation, it's priceless.
CHEST is one of the most significant resources of information, but it's also a very important network how I obtain information from my colleagues. And so I think we need to be more actively participating on the financial commitment to support the CHEST Foundation. It will help our community, it will help us, and it will keep our profession more relevant on this healthcare environment.
Lung cancer kills more women than the top 3 female cancers combined. We are always going to champion those issues. If you can't breathe, you can't do anything. And so you always need your lungs for something, and it's something you never think about until you can't do it.
I think 95 cents on every dollar that's given to the CHEST Foundation goes to programs and services, and there are just so many exciting and good things happening and that can happen.